Good evening, everyone. See, today we are going to have our 470th program. It is going to be in English, maybe mixed with the Tamil and Malayalam, because the chief guest speaker from Kerala. She's a dentist. Dr. Dhana Lakshmi is here by profession, dentist. He is a writer by fashion. She wrote two books, one in English and another one in Malayalam, but I don't know what are the name of the books. She will tell us. She has started her career VPS Healthcare Group, and she worked in Indira Gandhi Cooperative Hospital, Alasseri, from Kerala. She is having a 10 years experience, practicing experience in UAE, working for Rayyan Medical Center in Abudhabi. She is a medical director and dental surgeon. Since everyone having dental issue, sometimes we are all background of mental issues. We always think that mental issues. The dental issue, when we say dental issues, our Mutaya Ramnathan immediately said, I thought it is mental issue. So today the program, mental issue, please keep in your mind, don't go mental issue, it is a dental issue. Okay, let us learn something, not something completely from Dr. Dhana Lakshmi about our mental issues, and then we'll let her talk the youth something what we need to learn from the complete issues of the problems what we are regularly facing, what we may face, anything she will tell. Then we'll ask our questions one by one. We'll learn more things from her. This stage is for Dr. Dhana Lakshmi now. Madam, you can start your talk.
Thank you very much, first of all, for inviting me for this program. And from where Mr. Stephen stopped, I will start from there, because most of the time dental issues lead to mental issues also, because a smile is very, very important. Alagarna Panna, when you say it is a girl with a beautiful smile, it doesn't matter whether you're dark, you're fair, you're pink, but a smiling face is always accepted in the society. And in today's world, just because our eating habits have changed. Munnadi ella njangal sugar cane, ella apple, orange, ella without cutting, and we eat. But today, when it is nuclear family, we have started making juice, peeling it. Even apple, we don't give children to eat like that. Even apple, cut panni kodukadu. So that is why there is no chewing happening all over the mouth. So that is why one major reason why we are facing dental issues very frequently. Plus, now there are a lot of cosmetic things happening. And before a doctor first thing the doctor will say is, you cannot do anything, you have to remove panavana. Even if it is one small bit of tooth, we can always do root canal, put a post inside and make a crown. So removing tooth is no longer a treatment. And another thing is, these days, dentists they don't appreciate removing teeth, because our teeth is in one line. So once you remove this teeth, say for example, this is your teeth, you remove this teeth, then what happens is this teeth starts moving this side, and this teeth starts moving this side. Later, it will go inside this. And then there will be cavity here, and slowly this teeth also will get damaged. So removing one teeth means then it is the beginning of your journey to the dentist. 1 month, 2 months, 3 months, you will keep going to the dentist. And actually, the problem is with us only. And ഏതെങ്കിലും പല്ല് remove பண்ணிയാൽ തന്നെ we should always remember to replace it back, either by bridges or implant. Bridging enna, it means like this tooth is not there, you make this teeth and this teeth small, idukku mele fix pannum. അതല്ല ഇംപ്ലാന്റ് എന്ന് വെച്ചാൽ അത് ഒരേ പല്ല് അതിന്റെ റൂട്ടില് ഒരു സ്ക്രൂ വെച്ച് ടൈറ്റാനിയം സ്ക്രൂ വെച്ചിട്ട് they put an implant there. So implant is always the safest way of replacing teeth, but it is quite expensive. For those who can afford implant, implant is the best choice, and it has no side effects, no complications, nothing. But when you are putting bridge, you are always spoiling two teeth also. First end up first when you see a black spot on the teeth, try to fill it then. Appo fill panniya complications illada pogum. But if you don't fill that, that black line becomes bigger and bigger. Pinna nammal endengilum hard aayittu endengilum like you eat a laddu also, the teeth will break. And once the tooth breaks, pinna it will have to go for root canal treatment and further expensive treatment. So the best thing is when you see a small line or black dot on the teeth, or you feel food is going between the teeth, please consult a doctor and do the filling. Pinne pallu cleaning ellarku oru thonale, when you clean the enamel will go, but no, that is a misconcept. Whenever you clean your teeth, ആ പല്ലിന്റെ സൈഡിൽ ഞങ്ങൾ ബ്രഷ് കൊണ്ട് പോകാത്ത കാൽക്കുലസ് പ്ലാക്ക് ഇതൊക്കെ പോകും, അല്ലാതെ യുവർ ഇനാമൽ വിൽ നെവർ ഗെറ്റ് ഡാമേജ്ഡ് ബൈ ക്ലീനിങ്. അത് യാരോ എപ്പോഴോ പറഞ്ഞ ഒരു മിസ്കൺസെപ്ഷൻ ആണ്, നമ്മൾ പല്ല് ക്ലീൻ ചെയ്താൽ അതിന്റെ ഇനാമൽ പോകും. ദാറ്റ് ഇസ് thoroughly wrong, and no enamel will go. And the recommended time for cleaning is once in 8 months. എല്ലാ 8 months ഒരു പ്രാവശ്യം it is good to clean your teeth. And again, another most commonly what you see is, if you feel last varana wisdom tooth, if it is not straight, you can always remove it if it is bringing any damage. So that is what I have to say on basically about dental programs. And what I would say is, start teaching your children eppadi brush panna venam. After every meal, tell them to wash their mouth. And you know, even if it is children, it is necessary to fill the teeth. And there is back, you will see one teeth which comes at 6 years. Many people think adu chinna pallu, adu po pinna pudhiya pallu varum, but that is wrong. That ആ പല്ല് പോയാൽ പിന്നെ വരുമേ ഇല്ല. ദാറ്റ് ഇസ് യുവർ പെർമനന്റ് മോളാർ ടീത്ത്. സോ അത് ഒന്ന് വന്നു കഴിഞ്ഞാൽ പിന്നെ ഇറ്റ് വിൽ നോട്ട് ഗോ. സോ ഇറ്റ് ഇസ് ഓൾവേസ് ഗുഡ് ടു ടേക്ക് യുവർ ഡെന്റിസ്റ്റ്, ടു ടേക്ക് യുവർ ചൈൽഡ് ഓൾസോ ടു എ ഡെന്റിസ്റ്റ് ടു ഫിൽ ഓൾ ദ ക്യാവിറ്റീസ്. പിന്നെ കുളന്തകളായാലും നമ്മൾ സേ ദാറ്റ് ഇസ് 6 years 7 years they have cavity, it is good to fill the teeth, because you know food will go inside and children will not brush frequently, so that will become big and big, and then they will get swelling, they will get pain, they will cry in the night because of pain. All this will happen. So it is always good to take your child also to the dentist. I'm not trying to market dentistry, but what we see is you know, these children, when they don't realize that the teeth has to be taken care so well, they neglect it as teenagers, and then nowadays you see maximum teenagers coming with dental problems. So it is always good to have children being taken to a dentist. The next condition that you usually see in people are, people will say palla taniya aadadu, no cavity, no black. That is because your gum health is bad. Gum health, it is most of the time hereditary. Maybe your appa, amma, somebody will have bone problem. So that is why the bone will get losing, and then the tooth will start shaking. For that also, there is a specialty called periodontics, or you can see a periodontist who will do cleaning and fixing of your moving teeth. So this is one ball of thing I have to say. Everybody is going for bleaching and cosmetic Hollywood smile. 90% of the film actresses, everybody is going for something called Hollywood smile or veneering. ഇതിൽ ഒരു ദോഷവും ഇല്ല. Veneering is very good and it will make you look pretty also. ഒരു less than 0.5 mm tooth കുറച്ചിട്ട് they put veneer. ഞങ്ങൾ ഈ ടേബിൾക്കൊക്കെ veneer ഇടുന്ന പോലെ they put nice white color coating on the teeth and it is being stuck there. It will remain for 10 to 15 years. It will remain there and you will have beautiful smile. Second way of making whiter teeth is by bleaching. Bleaching is also, you have laser bleaching and chemical bleaching. Both of it doesn't have much side effects, except that you will feel little sensitivity for 1 or 2 days. That will just disappear. So in total, this is about, dental problem and dental issues.
Finished? So you want us to talk?
Yes.
Then okay, there will be a lot of questions.
Yes, please. Most willing to answer your questions.
Okay, cut and short talk actually. What are the problems you usually we face from dental? Only the cavity, or what kind of problems?
No, the problem is basically tooth pain. The problem is cavity, and sometimes what happens is the cavity becomes big. There will be swelling in the root, and then even there are cases where the root also gets damaged. The nerve next to it also gets damaged. So that is one main thing. Then the next bad habit is smoking and pan chewing. Pan chewing has come down, but still there is a lot of people who is chewing pan these days, which is not good at all, because it definitely causes oral cancer. It is not 1 day or 2 days, but continuous pan chewing, especially with the chunambu, will definitely cause cancer, because this white chunambu is very hot. It will liberate heat. So when you keep it in your cheeks, it will keep liberating heat and it will cause one white patch in your mouth, which later leads to cancer. And another important thing is, if ever you feel that you have a broken teeth, please remove the teeth immediately or ask the doctor to cut or chip off that sharp edge. This sharp edge, skin is very, very, very thin. So the sharp edge will always rub against the cheeks, and that is also a cause for oral cancer. Now, oral cancer also, just like any other disease, is becoming very, very common. And what I feel is, oral cancer is one thing that we can stop, unlike, breast cancers and other cancers, because most of the time, oral cancer nammale varuthunnathana. Because you are taking tobacco, you are keeping a bad teeth in the mouth, you are keeping broken teeth in your mouth. So you are the cause, or you are the reason. Baki ella cancer, it is up to him. Almighty, bad luck, it will come. But most of the time, oral cavity cancers, we are creating it on our own. Especially under the labor class, they have all these small things that they keep under their lips that give them energy. They say they get energy out of it, but we don't know how much true it is. But it is usually another major cause for cancer. So what I would say is, it is always no to tobacco, always no to smoking. Whatever type of smoking is not good. You will say that, okay, pipe is good or cigarette is better. No, because all the time you are smoking, you are taking in warm air. This warm air is going to damage your oral cavity again, because like again I'm telling, inside the mouth, romba soft tissues and that. So that will definitely cause cancer in your mouth. So all this should be really stopped, because see, like other cancers, you don't know, like I told you, like see prostate cancers or cancer in the stomach, all this, it just happens without our knowledge. We like spicy food and all that we eat, and somehow you get all this. But oral cancer nammale varuttunna oru asugana. So it is always no to tobacco at any time of the day. Even if you tell stress, pressure, anything, there's no reason for smoking, because it is going to, see, you will be spoiling your family. Maybe you are the breadwinner in the family and then you get cancer, and sometimes it cannot be treated. You sell the house and then after that you die. The family will not have neither the house nor will they have you. So it is always, good to prevent any illness, not only in the mouth, but any illness. It is always good to prevent it, because once one the kazhinja pinne talking doesn't make any improvement. And whenever I talk of cancer, one thing I tell is, nammala chuttu ulla cancer vanna aalkare kandale, whoever is strong can beat cancer. Whoever is weak, ayyo enke cancer aanu parnu talarunna aalkare, they lose life very fast. Because one thing we should remember is, see, if God forbidden aarku varanda, but aarkengiലും cancer undengil, see, yesterday also you had cancer, so today you are going to the doctor and doctor is telling biopsy. Next day you will see that person difficult to get up from the bed, they will be finding difficult to walk, they will need a wheelchair, they will need. So this is purely psychological. So what I have to say is, if ever anybody getting this illness, they should be strong and they should fight it out, because only when you're strong you can fight any illness around you. So you have to be mentally prepared, and mentally, you should keep yourself strong to fight whatever illness. Anyway, one day we will all die, but let us make our death also peaceful rather than making things complicated.
Good. So any questions from audience? Madam, வாங்க.
First clap பண்ணிடலாம் sir.
Yeah, okay. We'll
She has done wonderful and short and sweet session.
Thank you
So
so much, ma'am.
thank you, doctor. I have some few questions, ma.
Sure.
In RCT they put the cap.
Yes.
If that cap also sometimes gets broken little means, should we change it fully?
Yes, you should change it.
Change it.
You should
In
definitely.
gums, you said gums, they are very, such a soft part of it.
Yeah.
So for strengthening the gums, as a conservative measure, what can we do, ma'am?
That is what I said. Brushing morning and evening, and once in 8 months you do cleaning for your teeth. That is more than enough. When over brushing, you don't have to do. Most of the problem that we Indians do is we use hard toothbrush and we brush very hard. When you brush very hard, what happens is the enamel keeps going away and you will get sensitive. You will see cut-like thing on the side of your mouth. So it is always good to use a medium brush and brush your teeth very gently, rather than, morning hurry. Don't do that, because that will also create, it will hamper your gum also, and it will cause loss of enamel. And don't eat too much of citrus fruits, like, lime. Some people have this habit of eating lime and all that. That is not very good, because lime has a property to remove the enamel also. So to make
Oil pulling.
Sorry?
Oil pulling is suggested normally for cleaning the mouth and all.
Yes, it
does
is
it
good.
actually help our, for keeping up our dental health?
Yes, it does, because it is an old practice, but we are not against any of the old practices, because most of these things, they have an antioxidant property. So you gargle with it is always good. We will not say it is bad. And also when you have small ulcers in your mouth, it is very much okay to take warm water, put a little salt and gargle. All the grandmother's techniques are still, they have a scientific base. It is not summane salladalla. It has a reason behind it. So that is all perfectly fine.
Previously, I mean, our forefathers were using charcoal powder, and those were said to be not to be done. Now we are using 100%. All the people are using only paste,
Yes,
toothpaste only.
yes.
Does that actually help or harmful, ma'am? Like using the powders, tooth powders, and
Using tooth powder and using toothpaste, we would always recommend using toothpaste because paste is very soft. When it is powder, there will be granules in it, which will again cause small scratches or rashes on the teeth. So instead of that, it is always good to use a toothpaste so that it will be smooth. There will not be any rashes or any crack or anything for the teeth. So always better than tooth powder. It is always good to use toothpaste.
thank
And
you.
again, I'm telling
Thank
you
you,
should
doctor.
always promote your children to eat fruits on the whole rather than making juices and cutting it and giving to them. Please promote, because only then the gum will get stronger. Otherwise, the gum will also be very weak.
Thank you, doctor. Thank you.
Thank you very much.
I have 2 questions, madam.
Thank you, madam. Yes.
See, once I undergo root canal treatment, how
Yes.
long it is liable to loss if I maintain my oral cavity clean and neat?
Usually they say the life of a root canal treated tooth is up to 10 to 15 years. But all the root canal treated teeth will need a crown, because what happens when you do a root canal, more tooth surface is being cut.
After the root canal treatment, I have fixed
So it should stay
crown
still.
fixing has been
It
done
should
in a
stay
neat manner. And I have one more doubt. In order to keep my gums intact, then after brushing the teeth, I use a product, Ayurvedic product called proprietary medicine called gum tone.
Okay, gum tone is good, sir. Gum tone is good for the gum.
Tone
No
is
harm in
good.
using gum.
And how do you advise at the time of going to sleep using a mouthwash?
Mouthwash is good, but it is always good to use a toothbrush and to clean the teeth, because mouthwash will not go through the small gaps which is there between the tooth. So better than mouthwash, it is always good to use a toothbrush and toothpaste before you go.
I do that later on.
Later on, using a mouthwash will not create any problem.
Thank you.
Very well, sir.
Thank you. Vanga. Come, Ramu sir.
ஒன்று வந்து நான் ரெகுலரா for the past nearly 10 years or so I do oil goggling in the morning. Goggling எனக்கு வந்து when I goggle maybe I walk for about 10 to 20 minutes. So walking exercise கிடைக்குது, goggling கிடைக்குது. I keep doing that for the past 10 years. I walk minimum 10,000 steps in India and 20,000 steps in USA.
Okay.
சரியா? அப்புறம் இந்த பல்லு வந்து நம்ம நான் நார்மலா கால்கேட் சாப்பிட்டு இல்ல கால்கேட் சென்சிட்டிவ் டூத் பிரஷ் தான் யூஸ் பண்றேன். பியாண்ட் தட் ஃபிளாசிங் அப்படின்னு ஒண்ணு யூஎஸ்ல சொல்றாங்க, ஏதோ ஒரு வயர் மாதிரி ஒண்ணு வச்சு பண்றாங்க. பட் என் பல்லுல எங்க கேப் இருக்கிற மாதிரி எனக்கு தெரியல, வயர் போகுமான்னு எனக்கு தெரியல.
வயர் எந்தாயிலும் போகும், because the diameter of the floss is very thin. So it will definitely go between the teeth. But when you're flossing, you should always remember not to damage the gum. Some people, they put it down and on the gum, because that will create again problem for the gum. So like I said, it is always good to brush your teeth and keep it clean.
மார்னிங் பிரஷ் பண்ணாட்டி கூட பரவாயில்ல, நைட் பிரஷ் பண்ணணும் அப்படின்னு.
Yes, because brushing at night is very, very important than brushing in the morning, because all the food that you have taken is getting accumulated here and there in your mouth. So morning brush cheydillengilum night brushing is compulsory.
Right. அப்புறம் தமிழ்ல ஆலும் வேலும் பல்லு பொருதி அப்படிம்பாங்க. மீனிங் இந்த ஆலமரம் இருக்குல்ல, ஆலமரத்துக்கு என்னப்பா இங்கிலீஷ்ல யாராவது தெரிஞ்ச சொல்லுப்பா.
Yeah, I understand almaram.
ஆலமரம் அது குச்சியை எடுத்து அவங்க பிடிச்சி they will bite on it and they will make it like a brush.
Yes.
And then they will brush with that. நீ இப்ப சொல்ற பார்த்தா ஈவன் ஹார்ட் பிரஷே டஃப்னு சொல்றீங்க.
Yes.
அவன் ஆலமரத்து குச்சி ஸ்டிக் வச்சு பிரஷ் பண்றான்.
Yes, that is an old practice that is happening. Like I told you, see, Pandalla, there people are eating raw food. So even if they brush with stick, it is not affecting the gum. But now because we are eating very soft food, we are eating all that is grinded, pasted, everything, even chicken goes boneless. So in that time, it is always good to use a brush.
Very good. Thank you. Thank you very much.
Thank you very much, sir.
Thank you, sir. Narayan sir, are you there? Yes, Chitra madam.
Hi, Dhana Lakshmi ma'am. Very good evening.
Good evening, madam. Good evening.
Good evening. Adipoli advices and informations how the dental issues arise and how to protect ourselves from all that and our children's too from the beginning.
Yes.
Simple and clear explanation. I am 57. Till
Okay.
now, I don't have any dental issue.
Oh, that is wonderful.
Further, I will follow your valuable advices regard my teeth, ma'am. നിങ്ങളുടെ നാട് ഏതാണ്?
Kannur.
കണ്ണൂര്. മദർ ടങ് മലയാളിയോ?
Malayalam. Yes.
ഞാൻ പാലക്കാടാണ്.
Okay.
അതെ അതെ
അതെ എനിക്ക് നന്നായിട്ട് മലയാളം
നാട് ഏതാണ്?
സംസാരിക്കാനും വായിക്കാനും.
Oh, you can read also.
Yeah. Basically, I'm a Keralite, but 30 to 35 years I am in Coimbatore, Tamil Nadu.
Okay.
And after marriage, I came to Tirupur, nearby Coimbatore.
Okay.
എന്റെ മക്കള് പിന്നെ എന്റെ ഹസ്ബൻഡൊക്കെ നന്നായിട്ട് മലയാളം സംസാരിക്കും.
Oh,
ആവശ്യത്തിന് തന്നെ അവര് സംസാരിക്കും. പക്ഷെ അവരൊക്കെ വളർന്നതൊക്കെ തമിഴ്നാട്ടില് തന്നെ.
Okay.
പിന്നെ എനിക്ക് അവിടെ തന്നെ എന്റെ നേറ്റീവ് ആണ്. നിങ്ങളുടെ ബന്ധുക്കളൊക്കെ അവിടെ തന്നെ ഉണ്ട്.
Oh, okay. പാലക്കാട്.
അതുകൊണ്ട് എനിക്ക് ഇന്ന് നിങ്ങളോട് സംസാരിച്ചത് വളരെ സന്തോഷം.
Thank you so much.
Thank you, ma'am.
Very much.
There is no issues, only Malayalam.
മലയാളം, തമിഴ്, ഇംഗ്ലീഷ് മൂന്നും പേസിയാச்சு.
She was happy talking in Malayalam at last.
ഇവിടെ എനിക്ക് കമ്പൈനേ ഇല്ല.
അതെ.
எங்களுக்கெல்லாம் தெரியும் உங்களுக்கு மலையாளம் தெரியும்ன்றது, அதுக்காக இப்படியா?
கொஞ்சம் കടുപ്പേത്തലാണ്ട്.
ചിത്ര മോളെ ഇവിടേക്ക് വരൂ, അടിച്ച് പപ്പടം ആക്കുന്നു.
Shivashri madam, please. Shivashri.
Good evening. First of all, thank you so much, Dr. Dhana Lakshmi. Very interesting and very clear concepts. I'm unable to put on my camera. There seems to be some problem.
No
I
issue.
would like to know from you, there is a gap in my front teeth.
Okay.
And it seems to be widening a bit.
Okay.
Now, what would you suggest to close the gap?
Yes, I would definitely suggest to close the gap, because if the gap is increasing, that means you have a gum problem arising. So only when the gum problem is arising, the tooth will start moving from one to the other. So it is always good, because nowadays it is very easy also. Once sitting to the dentist, they will put something called composite material, which is tooth colored, and that will help to close the gap. So definitely you can close the gap and do some gum treatment, because that is the initial beginning of a gum problem.
Okay. Thank you so much. That's encouraging. So it's just one sitting and a composite which will fix it up, is it?
Yes, composite will fix it up.
And I also see a lot of cosmetic, solutions to this available online. Would you ever suggest that one goes in for it?
Right.
And also the use of neem stick used to be quite prevalent. Do you suggest that, it's
No,
healthy?
in this century, we don't prefer neem stick. Again, like I told you, because our food habits have changed. We no longer have such strong teeth which can, fight with the neem sticks. That is why we are always advocating not even to use hard brush. It is always good either to use a soft brush or a medium brush, but never go for a hard brush, because hard brush can always damage your gums. So that is why again, neem stick no and hard brushes no.
Thank you. You talked about cleaning process. You talked
Yes.
about, what does this actually involve?
Sorry, can I have
Cleaning. You said it's important to have have the teeth cleaned once in at least
yes,
6 months or 8
once
months.
in 8 months, I said.
8 months,
See,
yes.
it takes care of the gum health, because when you are cleaning, there will be some calculus and some deposits inside the teeth which we cannot see in the mirror. So when
What
you
is
go
the
to,
process involved? What is the procedure?
actually the procedure is we have a vibrating screw, like it's not a screw actually, it's a tip which is vibrating with water along with it. So what it does is during the vibration, whatever calculus or any deposits are there, that only will be removed. And this instrument doesn't have the power to take off the enamel. Enamel is the hardest subject or the hardest thing in the body. So enamel cannot be easily taken off by such instruments. Only with a burr that we make, the drill the cavity, only with that we can remove the enamel. So cleaning will not do any harm to the enamel.
Thank you so much. I remember going through the cleaning process now when I had a crown fitted in.
Yes.
So I think it's the same process.
Yeah, it is the same
It's
procedure.
same.
And after cleaning, sometimes for 1 or 2 days, you will feel little sensitive. That is because the calculus inside is gone, and there will be a gap between the tooth, but that will remain only for 2 days.
Okay, thank you so much. Just
Welcome.
one last question. My daughter has tooth, overlapping, one above the other growing.
Okay.
And at one stage, it was like she was quite keen to go to the dentist and fix it up.
Okay.
And after that, she says, no, it enhances my smile. So she continues. What is it? Is it okay to?
It is okay, because nowadays people like to have such teeth. A little crooked teeth is also a part of, looking good. So
Okay.
if she is comfortable with it, it's
Yeah.
absolutely fine. But otherwise, she can take an orthodontic opinion and go for braces. But as long as she is happy with the smile, because many of the actors, even Manju Warrior, has, one crooked tooth, and that will give, a very beautiful smile. So if she is happy, please leave her alone.
Thank you. Thank you very much. It's a
Welcome.
real pleasure conversing with
It
you
is a
and
real
getting
pleasure.
all your answers.
Thank you.
very
Thank you
much.
so much.
Thank you, Shubhashri madam. Shivkumar sir, please. Shivkumar sir, please come.
Yes, I'm here. Thank you, doctor. Thank you, doctor.
Welcome, sir.
Very informative.
Thank you.
Very informative. I am 76. I have no problem. Teeth problem till date. Till date, I have no
That's
problem.
excellent.
But I have cleaned my teeth at least twice in my life. Twice. Is it necessary for us? It's the last time. It's more than 6 or 7 years since I cleaned. Is it necessary for me to go and check up my?
No,
cleaning,
sir. If you don't have any problem, once a year, it is fine. Otherwise, you don't have to keep doing it.
Once
Unless
a year,
you have something like gum bleeding, or you have something like bad breath, only then you need to go for cleaning. But otherwise, you don't have to go for. And also another reason for bad breath can be because of acidity of stomach also. It need not be, because your teeth is not clean. Sometimes what happens is, if you have an ulcer in the stomach, or you're not eating food at a correct time, there will be a lot of gas forming. So this gas is being expelled through the mouth. So that also causes bad breath. So bad breath has 2 reasons. One is oral, and one is because if you have any stomach problem. So if your dentist tells you that your teeth is perfectly fine, then you can see a doctor and correct your ulcer or your gastric problem.
Halitosis, la?
Thank you. One information. My father and mother lived till about 85, 88. They have never had any teeth issues.
Yes.
Their teeth are always till their death perfect.
Okay.
No one single teeth has fallen. Maybe
Okay.
mother had a little teeth last year, otherwise she had a perfect
Very good
teeth till
certificate.
the end.
Yes.
This is for information. They were using only the charcoal powder. Maybe that
Ah.
Gopal pulp powder.
Yes. Sir.
Almost they use only that charcoal powder or Gopal powder. On later age, they used to have the face and only use the finger, not even brush.
Yes. Yes.
This is
Yes.
my parents' lifestyle of
Okay.
just for information.
Yeah.
Thank you very
Thank you,
much.
sir.
Very
Thank you very
informative.
much.
Thank
Yeah.
you.
Thank you, sir. Thank you. We understood that why you are not getting problem. ஒண்ணும் இல்ல,
Thank you, thank you.
உங்க hereditary தான், வேற ஒண்ணும் கிடையாது. தெரியுது நல்லாவே. வெரி குட். So
உண்மைதான்.
இன்னும் அவர் மூளையே யூஸ் பண்ணலன்னு சொல்ல வரீங்களா?
நான் சொல்லல சார், நீங்க தான் சொல்றீங்க.
Don't put the word into my mouth.
Yes. Please, Ravi sir. வாங்க.
Good evening, doctor. Very good narration. As usual, very basic information you have provided.
Thank you.
See,
very
everybody
much.
wants to come to the dental doctor, but only the cost that only makes it difficult.
That is a
And,
major problem, but we can't help it because things are very expensive also. So
No, for
you know,
primary teeth cleaning itself, they are charging very huge, enormous amount. And the root canal, you are gone. And if you go for the implantation, means that's all. You will have to
no,
write
that is
your
why, sir,
answer.
I keep telling
give
when you have a small cavity itself, you please fill it so that it is over with 250 or 300 Indian rupee. Because instead of that, you keep that for a long time. Then the teeth breaks. Then it goes for root canal. Root canal, they will charge you 1,800, 2,000. Then again, they will tell you crown. Crown will be another 3,000. So that is why I told you, please start treatment when you see a black dot or when you see that, you know, some food is going between the teeth. Please visit a dentist so that it doesn't become bigger.
Oh, this is possible for middle class or rich people. What about poor
Yes.
people? Where they will go and get this kind of treatment? Whether in the government hospital, this
Yes,
kind of
sir.
treatments
Government
people are
hospitals, nowadays, government hospitals are very well equipped. So they have all the facilities in the government hospitals also. Because now the government itself, they are taking all postgraduate doctors also. So this is available everywhere. It is just because we don't go and find out what is happening. We have
Ravi
that.
sir, one
Sure.
minute. Ravi sir, in
Yes.
all dental colleges,
Yes,
government
Yeah.
dental colleges,
They
it
have
is
hospital.
but madam told these facilities are very much available at government setup.
yes, sir.
Even in Chennai, it is best one.
Yes,
Yeah.
yes, very
Best one.
Opposite of Fort Station. Yeah.
Yeah.
No, what is the cost of implantation and all approximately? Just for an idea.
well, implantation is around 25,000, I think, in India now. But because I'm not much in Indian market now, I'm not very aware of the price. But I think between 15 to 20.
30,000.
30,000, about 30 to 40 they are suggesting.
Because the titanium screw that they are putting inside, it has to be of a very good quality because it is going to remain in your body even after your death. So,
And
and
that's what
yeah,
you are telling there is no side.
this titanium implant, they have to be very hygienic and it should not create any infection. So they have very fine material for implant. So that is why implants are very expensive.
Okay, madam. Since I know a little bit of Malayalam, whatever you are told in Malayalam, we are able to understand. Thank you. Thank you, madam.
Thank you.
Is there any way of reducing the cost by combining metallic with ceramic teeth, madam?
Actually, with crown, you can always opt for metal also. There is no harm. But nowadays, we are more aesthetic conscious because remember, olden days, people used to keep golden teeth. Now that concept is yeah, it is totally changed. Now people want same color of the tooth. That is why we are preferring ceramic and zirconium. But otherwise, you know, and zirconium and ceramic, they are very stronger than metal crowns. Metal, as and when you keep eating, it keeps, you know, the surface gets corroded away. So it is good to have a ceramic, but if you can't afford a ceramic, there is no harm in keeping a metal crown also. And even if your crown falls off, you can always replace the crown The same crown, please don't throw away the crown. Take the crown to the dentist, they will fix it back for you.
Thank you, Ravi sir. Please, Ramu sir, again. Want to talk? Let Ramu Narayanmurthy talk.
Yes, sir. Yes, sir. Sorry. Thank you. Madam, I couldn't be here throughout the meeting. I had some engagements. Anyhow, I don't know what.
It's okay. You just ask the question, whatever you want.
Okay. The thing is, see, suppose we have a sensitive issue in the teeth. What I find is there is not a permanent solution for it. See, we use some herbs or use some paste, we use some precautionary methods to come out of it. Is there any permanent remedy for?
Yes, sir. See, like what I told you, the sensitivity, there are 2-3 reasons for sensitivity. One is because we are over brushing the teeth and the enamel goes away. Yes. In that condition, we can always put a filling material to cover that area. So the sensitivity goes.
No, okay. See, yes. What I am asking, without covering, is there any way to?
Yes, and another thing is, you know, nowadays there are toothpaste for sensitive tooth. Okay, you have Sensodyne for sensitive tooth. But what I would recommend is, please do not use that for a long time because it doesn't give the required result. What you do is you buy 1 tube of toothpaste for sensitiveness and then go back to your same old paste, Colgate or Close-Up or whatever it is. Continuous usage of toothpaste which is for sensitive tooth is not good. That will not give you a solution. Okay. And even if you have a sensitive teeth, what I would suggest is apply some toothpaste for sensitive teeth on the place where you have sensitivity. Leave it for about 2 to 3 minutes and then brush it off.
Okay. The enamel cannot be restored.
Enamel cannot be restored, sir, but there is again, like I told you, there is something called composite material which replaces the lost enamel. So in that condition, you don't need to drill a hole or anything. That space which is causing the sensitivity can be just covered with composite material.
Oh, I see. And this is the only area in the human body where nature cure does not apply.
Yes.
I have seen, madam. I have done a lot
because
of.
The enamel doesn't grow back. Everything else grows back.
Yes.
Enamel doesn't grow back.
For any issues, there's a nature cure. Only for dental issues, there is no nature.
Right.
You can manage it. That's all.
Yeah.
In my opinion, you can manage it.
Sir, we can use white Asian paint enamel.
Very good idea, sir. Very good idea. Thank you very much, madam.
Thank you, sir. Thank you, sir.
I will hear the recording tomorrow. Thank you very much.
Thank you very much.
Ramu sir.
Thank you, Stephen. இப்போ டென்டிஸ்ட்ரிங்கிறது வந்து எங்கேயுமே இன்சூரன்ஸ் ஒழுங்கா கொடுக்கறது கிடையாது. கேட்டா அது டென்டிஸ்ட் இல்லைங்க, அது பேர் காஸ்மெட்டாலஜி, அழகு கலை, முகத்தை அழகாக ஆக்குகிறோம், எல்லா நடிகருக்கும் நடிகைக்கும் அது மாதிரி அழகா ஆக்கணும்னு சொல்லிட்டு அதை கொண்டு போய் காஸ்மெட்டாலஜியில போட்டானுங்க இன்னைக்கு ஒரு ஏரியா. அப்புறமா பெயினை பத்தி சொல்ற போது நான் ஜெனரலா ஐம் சைக்காலஜிஸ்ட், கூட கொஞ்சம் கனெக்ட் பண்ணிட்டு வர்றேன். சரியா? பெயின் பத்தி சொல்ற போது renal calculi is the unbearable pain number 1 ன்னு சொல்லுவாங்க.
Yes sir.
Kidney has got a problem and you cannot pass urine and it gets blocked. That's the greatest pain. Second pain வந்து dental pain.
Yes sir.
மூணாவது pain தான் pelvic pain, delivery. There's a gap available, there's a flexibility is also available. Yes. Pelvic pain, delivery pain, ஆகா பிரசவ வலி, மூணாவது வலி தான் அது பல்லு வலி. அதுக்கு முன்னால பல்லு வளராது, நகராது.
Very true, very true.
That's a renal calculi number 1, dental pain number 2, delivery pain number 3 சொல்றாங்க. யூஎஸ்ல ஹெல்த் ப்ராப்ளம் என்ன ஃபார்ம் ஃபில் அப் பண்ணாலும் இந்த டீத்தை பத்தி ஒரு கேள்வி கேட்டுறாங்க.
Yes, definitely.
நீங்க do you have a regular every year
once in a year you have to check.
Invariably எல்லா ஃபார்ம்லயும் இருக்கு. நீங்க வேலைக்கு போனாலும் சரி, இன்டர்வியூ போனாலும் சரி, எஃப்எம்ஆர் போனாலும் சரி, ஃபுல் மெடிக்கல் செக்அப் எதுக்கு போனீங்கன்னாலும் இந்த கேள்வி ஒண்ணு இருக்குது. இது என்னத்துக்கு டென்டல் கேள்வியா? இந்தியாவுக்கு மாதிரி கேட்கறதே இல்லையா நாங்க? யூஎஸ்ல ரெகுலரா எல்லா ஃபார்ம்லயும் கேட்கறாங்க. அப்புறம் சிட்ரஸை பத்தி சொன்னீங்க. I do not know, you might have gone to US. நம்ம இந்தியா எலுமிச்சம்பழத்தை போல குறைஞ்சது 2ல இருந்து 4 பங்கு பெருசு இருக்கும் யுஎஸ் எலுமிச்சம்பழம். ஏன்னா அது நான் வெஜிடேரியன் எலுமிச்சம்பழம். எல்லா வெஜிடேரியனும் நான் வெஜிடேரியன் தான் வச்சுக்கோங்க. அது பிளான்ட்டை வளர்க்கறதே நான் ஈட்டபிள் ஆல் அனிமல் ப்ராடக்ட்ஸ்ல அது தலையோ குழம்போ எலும்போ என்னத்தையோ அதை போட்டுதான் வளர்க்குறானுங்க. இவ்வளவு பெருசு இருக்கும். அது லெமனை போட்டு கட் பண்ணி 3 இங்கதான் இந்தியா 2 கட் பண்றது. யூஎஸ்ல 3 கட் பண்ணி புழிஞ்சிட்டு அது உள்ள இருக்கிற எல்லாத்தையும் எடுத்து போட்டு அதுல சால்ட் போட்டு சுகர் போட்டு சாப்பிட்டா ஆஹா அப்படின்னு இருக்கும். ரெகுலரா நான் சாப்பிட்டுட்டு அப்புறமா மறுநாள் எதுவுமே சாப்பிட முடியாம கஷ்டப்படுவேன். அவ்வளவு சென்சிட்டிவா இருக்கும். ஆனா அந்த சிட்ரஸ் இருக்குது பாருங்க, எலுமிச்சம்பழம் புழிஞ்சதுக்கு அப்புறம் மிச்சம் இருக்கிறது அதுல சால்ட்டும் சுகரும் போட்டு சாப்பிட்டீங்கன்னா செம்ம கிக் வரும். சாப்பிட்டு பார்த்தவங்க மட்டும்தான் அது தெரியும், மத்தவங்க செக்அப் பண்ணி பாருங்க. சரியா? அதுக்கப்புறம் என் பொண்ணு 5 வயசு இருக்கிற போது, லாங் பேக் நான் சொல்றேன், 30 years பேக், புது வீடு வாங்கினோம். புது வீடு ஏற்கனவே இருக்க வீடு செகண்ட் ஹேண்ட் வாங்கினோம். இந்த ஃப்ளோரை மொசைக்கை வந்து நாங்க பாலிஷ் பண்ணோம். எக்ஸ்ட்ரா கிரீம் போட்டு ஏதோ ஒரு பாலிஷ் போட்டு பாலிஷ் பண்ணி முடிச்சோம். குழந்தை நடந்து வருது, கால் ஸ்லிப் ஆகுது, சறுக்கும், வலிக்கு வலிக்கு விடும். நேர போய் கதவு திறந்து இந்த கதவுல நேர போய் முட்டி அந்த ஒரு டீத் ஆங்கிள் பட்டு உள்ளுக்கு போயிடுச்சு. வலிக்குது, பிளட் வருது. எங்கேயுமே பார்த்தா கீழே எங்கேயும் பல்ல காணும், பல்லு உள்ளுக்கு போயிடுச்சு. இட் வெண்ட் இன்சைட். அப்புறம் வலிக்கு பொண்ணு கத்திட்டே தான் இருக்குது. டென்டிஸ்ட் கிட்ட கொண்டு போனா டென்டிஸ்ட் சொல்றாரு உள்ள போயிடுச்சு. சரி என்ன பண்ணலாம், ஒண்ணும் பண்ணணும், விட்டுருங்க, பெயின் ரிலீவர் மட்டும் கொடுங்க, அது சரியாபடுறாரு. 10 years it was okay, ஒரு ப்ராப்ளம் கிடையாது. இந்த கம்முக்கு க்ளோஸ் ஆயிடுச்சு, இட் வெண்ட் இன்சைட். பால் பல்லு, 5 வயசு பால் பல்லு அப்புறமா வெளியில வர ஆரம்பிச்சு. அதுக்கப்புறம் இது வெளியில வருது. அந்த பல்லும் இந்த பல்லும் மீட் ஆகுது, வெளியில வர மாட்டேங்குது. அப்புறமா வலிக்குதுன்னு சொல்லி பார்த்தா இங்க தேர் இஸ் நத்திங் தேர். அதே டென்டிஸ்ட் கிட்ட கொண்டு போனா அந்த சொல்றாரு உள்ள இருக்கிற பல்லு பால் பல்ல வர விடாம கெடுக்குது, அதனால சர்ஜரி பண்ணணும்னு சொல்லிட்டு இப்படி கட் பண்ணி அது யூ போட்ட மாதிரி அது ஒரு சர்ஜரி பண்ணி அது எடுத்ததுக்கு அப்புறமா இந்த மேல இந்த பல்லு வெளில வந்தது. அப்புறம் பால் பல்லு மில்க் டீத் வெளியில வந்துச்சு. So அது ஒரு நாவல் கைண்ட் ஆஃப் an experience about teeth which got my daughter learning experience. அதுக்கப்புறமா நான் சின்ன பையனா இருக்கிற போது ஒரு 4 அடி 4வது படிக்கட்டுல இருந்து 3வது படிக்கட்டு, மேபி I am less than 10 years old. I fell down straight on my face. ட்ரிப் ஆகி வேகமா ஓடி வரேன், என்னை யாரோ துரத்துறாங்க. இன்னும் 3 படிக்கட்டுன்னு இருக்குது. அப்படியே நேரா விழுந்தது. இந்த ஃப்ரண்ட் டீத்து பாதி உடஞ்சு போச்சு. இந்த மேஜரா 2 இருக்கு முன்னால half of it went away. ஆனா several years அந்த half டீத்தோட நான் அப்படியே இருந்திருக்கிறேன். என்ன பல்லு உடஞ்சு போவல்னு சொல்லுவாங்க, நான் அதை பத்தி கவலைப்படாம அப்படியே இருந்தேன். இன்னைக்கு மாதிரி இல்லை, I lived with that. அதுக்கப்புறமா என்ன பண்ணாங்க, கொஞ்சம் வளர்ந்ததுக்கு அப்புறமா சரி இந்த இது வேணாம், பாதி பல்லு நல்லா இல்லை அப்படின்ட்டு அந்த பல்லை எடுத்துட்டாங்க. மத்த எல்லாரும் 4 பல் இருக்கும், எனக்கு ஃப்ரண்ட்ல 3 பல் தான் இருக்கும். ஆனா தெரியாது, மத்த எல்லாம் வந்து ஃபில் பண்ணிடுச்சு. ஸோ ஐ லிவ்ட் வித் தட். ஹாஃப் டீத்தோட நான் several years இருந்திருக்கிறேன். அது இப்படி பார்த்தா அந்த இடத்துல பாதி பல்லு தான் இருக்கும். அதை பத்தி நான் கவலைப்பட்டதும் கிடையாது, அது வருத்தப்பட்டதும் கிடையாது. அது இருந்து அப்படியே இருக்கு, அவ்வளவுதான், உடஞ்சது போயான்னு விட்டோம். அதுக்கப்புறமா நிறைய சைனீஸ் டாக்டர்ஸ் இருக்கிறாங்களே, அது எப்படி எல்லா நாட்டிலையும் சைனீஸ், யூஎஸ்லயும் பார்த்தேன், இந்தியாலையும் பார்த்தேன், கல்கட்டாலையும் பார்த்தேன், சென்னையிலையும் பார்த்துருக்கேன். டென்டிஸ்ட் சொன்னோம்னா சைனீஸ் டாக்டர்ஸ் இருக்கிறாங்க. How come there are so many Chinese doctors? அப்புறம் இன்னொரு 1-2 முடிச்சிடுறேன். அப்புறம் அந்த காலத்துல நான் சின்ன பிள்ளை இருக்கிற போது இவ்வளவு பெரிய நீடில் இருக்கும், 2 inches 3 inches. அதை வச்சு அந்த ஆள் ஊசி போட்டாங்கன்னா டென்டிஸ்ட் தான் மிகப்பெரிய சாட்டன், சைத்தான் அப்படின்னா யாருன்னா டென்டிஸ்ட் டாக்டர் தான். அந்த ஆள் அந்த வலிக்கு பண்ணுவாரு அப்படின்ட்டு டென்டிஸ்ட் பக்கமே போக மாட்டோம். பல்வலி பெட்டரு, டாக்டர் வேணாம் அப்படின்னு சொல்ற காலகட்டங்களா நான் வாழ்ந்திருக்கிறேன். சரியா? அதுக்கப்புறம் புளி உப்பு, பல்லு வலிக்குதுன்னு சொன்னோம்னா எங்க ஊர்ல புளியை எடுத்துக்கோ, அதுல கொஞ்சம் உப்பை சேர்த்து வச்சுட்டு அப்படியே பல்லு மேல ஒட்டி வச்சுட்டு சரியா போயிடுன்னு சொல்லுவாங்க. அது நம்பிக்கையில வந்துதான் நிஜமாவே வந்துதான் தெரியாது. ஸோ புளி உப்பு ஒன்று ஆன்சர் கொடுங்க. அப்புறமா சைனீஸ் டாக்டர்ஸ் ஏன் நிறைய இருக்கிறாங்கன்னு சொல்லுங்க. Tamarind and salt. How does that help?
Those are not nice practices because this puliyella, it will sort of anesthetize the gum and nerve. അതുകൊണ്ടാണ് pain പോകുന്നത്. Another, there is no other scientific. Even if you put clove oil, you will feel relief for some time, but it is not a complete solution.
Palliative, not curative.
Yes, it will not cure it fully. Like maybe you want to finish a night, morning to go see a doctor, you can put a little clove oil, but that is not the correct or healthy practice.
How come Chinese doctors are respected everywhere, or they are
Because
there?
there are a lot of Chinese colleges also, but now the number has decreased.
Yes, you are correct. Think earlier it was.
Yeah.
USA நிறைய Chinese dentists இருக்காங்க, கல்கட்டாலயும் நிறைய இருக்காங்க.
No, because Pandagalatha, you know, the barbers were pulling out teeth. So that is how this culture started coming. But now, because we have all dentists around, the Chinese people are very less.
Good.
Thank you, sir. Lata madam, come please.
Madam, just now I have joined. Sorry, I could not watch your program, but I will see recorded program. Doesn't matter. I have one doubt. The thing is, if I take one brush, one new brush, how many days it has to come approximately?
Actually, they say 3 months is one brush.
3 months. 2 times brushing or 1 time you?
2 times brushing.
2 times, 3 months it has to come.
3 months.
See, for me, I have been using medium only, neither hard nor soft. I will not buy. Medium I will use. Just 1 month only it is coming, ma'am.
That is because you're brushing. That is because you're brushing very hard. So don't brush so hard, because when you brush hard, the bristles will go like this.
Yeah.
Then after 1 month, you will have to change it.
Yeah, I have been trying softly. I will start, but over the time, maybe because
No,
of,
what you do is always brush in a circular motion. Then it will not, you know, all the, like, take 660 and brush it in circular motion. And when you're brushing like this, the bristles will go like this.
No, front side you can do like that. Whereas
Inside also you can do like that. You can just put it inside and brush it in a circular motion.
Oh, okay.
So then.
So it's coming for not even 1 month, 25 days, something like that only.
No, no.
But fortunately, by God's grace, I don't have any teeth problem.
Great.
So my husband, he told many times, then maybe yours method only correct. That is yours is better, he told. That's why I wanted to clarify from the right person.
I know.
Okay, thank you, madam. I'll watch
Lata madam, you should thank your husband.
Why?
Because you are not having any teeth problem.
See, he also may be wrong. That is why I clarified.
Yeah, no problem.
For all ladies, husbands are always wrong.
Madam, I have one last question.
Yes, please.
See, I'm running 75. After completion of the root canal treatment and other paraphernalia, when I get acute pain, maybe in the night or during the time of travel, and I have the habit of using taking measures. One, I use Colgate company product called Pain Out, which I drop 1 drop at the time of pain, particularly in the incisors region, and then the canine this thing. And occasionally I use, as you said, clove oil drops. And to maintain the gums and teeth intact together, I use a product called Dentogel. How frequently you recommend? Or of course, I do use it occasionally when I get acute pain in the night time. Is it okay if I can use it maybe once a day in a week? Is it allowed, or it's
Dentogel is always allowed, but again, like Dentogel is always allowed, but I will not encourage clove oil, because I told you clove oil will damage the gum again.
Oh, I see.
It just gives one anesthetic effect. Otherwise, there is no effect at all. So for temporary purpose, your pain will go, but it is not good to use clove oil because it is very concentrated.
The Colgate company advertise say that express relief from tooth pain.
No, toothpaste you can use, no problem. But
Okay.
pure clove oil, please don't.
Oh, thank you so much.
Welcome, sir.
Thank you, sir. Thank you. Anybody? Shankar Lingam, do you want to start? Any base paringla? Where are checking? Then we can find out. Anybody is there? Any questions?
One last question, if I may ask.
Please.
Doctor, we were talking about the expense, dental care being expensive. I have a dentist who's, very affordable, but his chamber is very shabby. So I hesitate to go there thinking, will I catch some infection, things like that. What is your take on that?
No, see, that is very, very important because see, when you go cheap means you are either compromising on something. So it is always good to go to a dentist, not a very high price, but don't go for these very small places where there is no proper sterilization because like I told you before, oral cavity gets infected fast. So it is always good to go to a hygienic place rather than opting for, see, because you are living for yourself. So at least give the luxury for yourself and see a good doctor who's following, proper sterilization techniques.
Thank you so much. Very reassuring. Thank you. Thank you very much.
Thank you. Thank you, everyone. Really wonderful.
ஒரு நிமிஷம்
Yes, sir.
இந்த கொரோனா பீரியட்ல சொல்லுவாங்க டென்டிஸ்ட் வந்து அந்த ட்ரில் பண்றாருல்ல மைன்யூட் டூத் அந்த டீத் பார்ட்டிகிள்ஸ் they will be up in the air. ஒரு ட்ரில் பண்ற போது ஹைலி கண்டாமினேட்டட் ஏரியா வந்து டென்டிஸ்டோட ரூம்.
எஸ் சார்.
நீங்க சொன்ன மாதிரி if it is going to be shabby, too difficult. So it's always good that we go to a doctor who is hygienic. சும்மா நான் ஃபார் சேஞ்ச் யூஎஸ்ல இருந்து வர்ற போது கிரஸ்ட் ஒயிட்னர் 3D ஒயிட்னர் ஒன்று எடுத்து வந்தேன். கிரஸ்ட் டார் ஏன்னா நீங்க சொன்ன மாதிரி கால்கேட்லாம் க்ளோஸ் அப்லாம் இங்க கிடைக்குது. அதனால மாத்தி சென்சிட்டிவ் அப்படின்னு ஒண்ணு சும்மா இருட்டோம் அப்படின்னு ஒன்று ஃபார் சேஞ்ச். ரெகுலர் கால்கேட் வேணா நம்ம ரெகுலர் க்ளோஸ் அப் பண்ணா ஒரு டிஃப்ரெண்டா இருக்கணும்னு வச்சுக்கிட்டோம்.
Okay.
Thank you, sir. Thank you. Really wonderful speech, and we learned a lot from Dr. Dhana Lakshmi. Do you want to say anything finally, Doctor?
No, that is all I have to tell. Just take care of your health and take care of your dental health. And I think we should start from the beginning when you see a black line on the tooth, rather than going for any other complications and making it expensive for you and your pocket. So I would always suggest everybody to, keep your teeth clean and hygienic. At least if you can't brush after every meal, please try to brush, especially in the night, and avoid all uses of tobacco because tobacco is not at all good for your teeth. So
good. So thank you very much. One final question out of the subject. Shall I?
Yes, sir.
ஃபைனலா நான் ஒண்ணு சொல்லிடுறேன், அப்புறமா நீங்க கடைசியில கேளுங்க. நாக்கு பண்ற எல்லா ப்ராப்ளத்துக்கும் பல்ல உடைச்சிடுறேன்னு தான் சொல்றானே தவிர நாக்க உடைச்சிடுறேன்னு ஒன்னும் சொல்ல மாட்டேன்றான்.
நாக்கு உடைக்க முடியாது.
பண்ற ப்ராப்ளம் எல்லாம் நாக்கு உடையறதுனோ பல்லுதான்.
அதுக்குதான் சொன்னேன் லதா மேடம் குடுத்து வச்சுங்கன்னு சொல்லிட்டு.
நீங்க உங்க கேளுங்க.
Okay, see, one last question. See, since we are a team of psychologists, we are doing some dream analysis here.
Okay.
So this question is connected with your dream. So what kind of dreams do you get frequently?
What a psychoanalysis.
What type of dreams do I get? I see happy dreams because most of the time I go to bed with a positive thought. So whatever I dream of, I get up with fresh mind, and I'm somebody who looks at everything very positively, and I feel that everything has a reason. Like now tomorrow if I am thrown out of job, that also must have a reason. So I basically
any dream do you remember frequently you had? Any dream? Do you remember frequently had?
Frequent dreams I have is most of the time I see elephants in my dream. Don't know because if I'm from Kerala, but usually I dream of going for some ulsav and some entertainment in
Do you
Kerala.
get dream about your surgery?
Sorry.
Your surgery. You are doing surgery, no?
Dental
Teeth surgery,
Yes,
surgery, and then you are giving treatment to the
Yes.
people. Okay, such kind of dream do you get while sleeping?
Not much, sir, but on a surgery day, maybe because we are thinking only about that, our mind is always thinking about alternatives and betterment of the patient. Only in
I
that
am asking
case,
this question now. See, you are taking the same message repeatedly, and the same things are you are seeing a lot of messages, related messages in your mind. See,
Okay.
while sleeping, it is processing or not. That's what I'm asking.
yes, sir, maybe it's because I have been practicing for more than 20 years. So it has become a routine now, It's like a
So,
few
so you are
who goes.
not getting that such
Yeah.
kind of
No,
dreams. Sometimes
just see, like a peon, he always goes and ring the bell. That is his only work. So on his mind, he has only that 4 o'clock I have to ring the bell, 9 o'clock I have to. So I think my life is also fully devoted to dentistry. So it's just a part of me.
thank you, thank you. And one more question.
Yes, sir.
Do you get dreams about your husband frequently?
Sometimes, yes. Especially
Sometimes,
when we pick a fight, yes, we get. Like every other family, we also fight, and then we keep dreaming that he will come and tell sorry, he will come and give you a gift.
is he getting dream about you?
I
Did he
think
share?
must
Did he
also
share?
be getting dreams
Did
because
he share
we
anything?
make life difficult usually, Instead of living as two individuals with all the rights, what we do is we interfere in the other person and make that person's life complicated. So what I always say to my married friends, or when I give a talk about all this marriage affairs, I keep telling, always consider your wife or a husband as an individual and give him all the respect, give him all the space. Like he wants to spend half an hour with his friends, please let him do that. You want to go alone with your friends, please do that, because life is only once and you have all the right to do what you want.
Absolutely.
Anyhow, thank you very much for sharing your personal things also. There's a request. What shall we know your book name of the books?
So actually it was done some 10 years back. So my English book is of poetry and it is called I, Me and I, where mostly I talk about women empowerment and the problems that women are facing. The other one is also a Malayalam book. It is called Kanaga Mundrigal. There also I depict a lot of problems that a woman face. By saying this, I am not a feminist or anything because I don't believe in a shoulder to shoulder relation. I wouldn't mind staying a step behind my husband and following his rules. But still, ladies, they need somebody to emotionally support them. So always when I'm writing or when I'm talking, I talk more about, the problems that women face. And it is because we are taking small things as very big things. That is why there is always a fight. And to married people, I always say, if your husband is staying 1 hour more for his work, he has all the right because he's earning for you. So we should respect his absence at home also. You see, like your husband has promised for a dinner or a movie and he has to work overtime. Please don't feel offended about that. Take it in a sportive spirit, make a good dinner, call him home, and let him also enjoy. Only then the relation works. So,
thank you. Thank you. At last, one request. One day again, you come and talk about your books.
Definitely, I will do that.
Yes. So nice of you. Really.
I believe in equal rights, sir. Whatever extra rights women have, they must surrender it to us.
Definitely, yes.
Equal. Yeah.
Thank you. Shall we clap for her again?
Thank you, sir.
We're happy. Really wonderful.
Thank you. I can hear you.
Spent a lot of time with us.
Thank you.
எல்லாரும் ரொம்ப சந்தோஷமா இருக்கும் மகிழ்ச்சி. It's a lot of thanks from our team and on behalf of Mind Your Mind. From myself personally, thank you for
Okay, sir.
accepting this. ரொம்ப சந்தோஷம். நன்றிகள்.
After 5 months, it's the model program.